Hi, my name is Sari Kives, and I'm an obstetrician and gynecologist. I will be speaking about pediatric gynecological emergencies for the Pelvic Health Series for WHEMS. As a pediatric gynecologist, I see a lot of emergencies. How one might present is you may come to the emergency department with the sudden onset of pain. This pain may have been present for 6 months. One of the common presentations we see is you come to the emergency department because you've been having repeated episodes of pain. You also are not getting your period. When we see a young woman, the age of 14, we would expect that she would have her period because the average age of getting your period is around 12. So if you get to the age of 14 and you come into the emergency department with pain, difficulty going to the bathroom, maybe difficulty passing stools, we have to investigate you for why you're having this pain. And one of the things that goes through my mind when you present with this kind of history is there an obstruction? Is it because you have absence of the vaginal opening? Or is there something obstructing the ability for the blood to get out of the uterus? This may sound scary, but it isn't actually that uncommon. It does require some investigation, and we would send you for an ultrasound to look if there is an obstruction. And you would also require a physical exam for us to look at your genital area and look at the vagina to see, in fact, if there is a bulge to support the fact that there's actually blood collecting behind that needs to be released. The good news is this can be quite easily surgically corrected in most scenarios. And by taking you to the operating room, we can relieve the obstruction and the pain will go away. So do not be afraid to ask for attention if you're having these acute episodes of pain that have been going on for several months. The other thing that we also see is acute pain or persistent pain that's been going on for many months, but you do have your period. So every month for 5 to 6 days you have pain in the presence of your period. For most of us, we would recommend you take Advil or Tylenol or Midol to help with your pain. And for most young women, this will relieve the symptoms of what we call dysmenorrhea. And it's just pain from prostaglandins that are released by your uterus that cause pain. However, occasionally, this pain will get very severe. And you may have to go to the emergency department because the pain is not being relieved with the normal medication that you usually use for pain. When we see you in the emergency department in this scenario, we look for other causes of the pain, and one of the more common reasons we see are ovarian cysts. Now, just to remind everybody, when you have a period, it is because you've created an egg that was released from your ovary. That release of the egg from the ovary can cause injury to the ovary. And you may get fluid leaking from the ovary called a cyst rupture, or the ovary may actually bleed and you may get a hemorrhagic cyst or blood-filled cyst within the ovary. These are really common. Occasionally, however, you may have a cyst in the ovary that's actually not a benign process, actually a pathology. And we think of things called a dermoid cyst. This sounds really scary, but it is really common. It's not a cancer. However, it is not supposed to be there, meaning it's not a normal functional part of the ovary. Regardless of what the etiology is, or regardless of what the cause is, we need to do some investigation. In the emergency department, you'll have an ultrasound to look at this, to see what is the cause of this young girl's pain. Why is she having such severe pain? We do an ultrasound to see, is this because the cyst ruptured and there's a little bit of free fluid in your pelvis and that's why you're having all this pain? Or is it because the cyst ruptured and you bled into your ovary and you have that hemorrhagic cyst I described? Most of the time, we can treat this expectantly, meaning you do not need a surgery, you do not need to be admitted to hospital, but we can give you good pain medication and send you home. And then 4 to 6 weeks later, we may bring you back to the hospital, to the outpatient clinic, so that we can re-examine you with an ultrasound to make sure that the cyst has resolved. Occasionally, however, This cyst will not be a functional cyst, but actually have some pathology like I described before, the most common one being a dermoid cyst. A dermoid cyst sounds weird, but it's just a cyst that was not supposed to be there, that is completely benign. It is not cancerous. The reason that we worry about dermoid cysts and why they cause problems is because when you have a cyst in your ovary like a dermoid, it creates a weight and it makes the ovary heavy. So if you're doing activities like gymnastics or biking, that ovary can twist on itself because of the activity. And when you have that twisting, it causes really severe pain. You may present to the emergency department because you're having vomiting, you're having a fever, you may have some nausea, and you may feel like you've been kicked in the gut because of how bad that pain is. The good news is that if you get seen in the emergency department, we will see you quickly. We will do an ultrasound, and we will try to rule out this risk of this torsion on the ultrasound. A torsion just means twisting. If we suspect that you've twisted your ovary, then you will require a surgery. We take you to the operating room where we will untwist the ovary and in most cases try to remove the cyst. The most common cyst being a dermoid cyst, but there are other reasons you may have a cyst on your ovary. The good news is this surgery is usually done as an outpatient. You get to go home the same day. The recovery is short. Often within 2 weeks you can return to your normal activities. And the good news is in most of the scenarios that this is a benign process. It's not going to be cancer. So it is completely treatable by the surgical intervention. Thank you very much for listening. I hope that I have explained to you the more common causes of reasons that you would come to the emergency department if you had sudden onset of pelvic pain. Thank you.